When you think of folk medicine, you might conjure up an image of an old granny doctor handing out bunches of herbs and roots to her community to help with their aches and pains. And for many years, this was the way folks in Appalachia were doctored. The knowledge of what plants were good for what ailments was closely kept by the yarb doctors, herbalists, and healers in the small communities that dotted these hills. As time went on, and highways were carved through the mountains, the old country ways were replaced by official medicines and licensed doctors who would diagnose and prescribe and follow up to ensure their administrations were correct in helping their patients. Nevertheless, many folks in this region continue to rely on the remedies of their ancestors. Herbalists still ply their trade across this great country of ours, but especially in Appalachia. Although he has met his reward, a good example of Appalachian herbalism is Catfish Gray, who would have West Virginians driving miles to receive his herbal remedies, sometimes without knowing what was in those brown paper bags. Academicians like Dr. James Duke recorded herbal remedies and studied the efficacy of these folk cures. Sometimes he was stumped as to why people continued to rely on some of the plant-based compounds. Natural product medicine has seen a great resurgence in recent years, and several commercial enterprises populate the market with a variety of pills, tinctures, and teas. To study folk medicine today is to ensure that you, as a pharmacist, can counsel your patients on the best practices of self-care. A patient may be taking an herbal tea to help with her joint pain, but that tea may counteract the medicine that she has been prescribed. In my elective, focusing on the folk medicine and herbal practices of the Appalachian region, my students learn about the medicinal uses of native plants, the active chemicals in the plant material, and the mechanisms of action of those chemicals. We also talk about herb-drug interactions and how patients self-medicating with herbals may be harming their health more than healing themselves. It is important to note that many of the herbal remedies used in this region do have strong medicinal properties. A good example of this is with a naturalized plant to this area, mullein. Taking a mullein leaf and tearing it, then soaking it in alcohol to make a strong tincture, creates an expectorant that will clear your lungs of any congestion and mucus. The beautiful foxglove flower has powerful medicine in all parts of the plant. For centuries, such ailments as edema or dropsy and congestive heart failure were treated with digitalis, an extract of the foxglove plant that stimulates the heart, causing its contractions to be much stronger. The medicine from the foxglove continues to be the only cardiotonic glycoside in the United States pharmacopoeia. And then there's the willow tree, from whose inner bark was extracted salicin, which, when ingested, becomes salicylic acid, an excellent pain reliever and fever reducer. To eliminate the corrosive effects of salicylic acid on the stomach lining, the chemists at Bayer developed a method to acetylate the acid to create acetylsalicylic acid, or aspirin. I also teach my students about the opioid epidemic of the 19th century. The chemists at Bayer tried to make the common remedy for cough, morphine, less addictive through acetylation and created diacetylmorphine. They named their product heroin for the almost heroic way it relieved cough and pain as well. The diversity of our elective curriculum at the University of Charleston School of Pharmacy ensures that each student is able to pursue her interests and avocations. You will learn your way with UCSOP and become a most excellent practitioner of the pharmaceutical trade.